We're going to discuss Medicare in the context of the Latino community, and then we're going to get to action. Everything in this convention requires action. We don't come here to convince each other about the
flourishing of Medicare. Unfortunately, things are changing and not necessarily going in the right direction. I'm not sure that people today understand what life was like before we had what we call the safety net. Doesn't that sound almost innocuous? Well, it's not. If you had your privatized Social Security in 2008, then your benefits would have dropped by 50%. And the check that you received from the government for $1,000 to survive, to have the money you needed to live, would have dropped to $500. The check you received for $1,500 would have suddenly been $750. That's gambling. And what they want to do is to make our most vulnerable population, our senior citizens, reliable on a gamble. Relying on a gamble. It's the same thing with Medicare, and it's the same thing with Medicaid. In the case of Medicare, what they want to do is to give you a check instead of the care you need, knowing that that check is not going to be enough to pay for the care that you need. The average person will have to pay $6,000 a year extra once Medicare is privatized the way that now it's different. Now there are people who are trying to exploit the economic misery that the country has faced since 2006, 2007, and 2008. And what they're trying to do is to get half of the population to turn on the other half of the population and to take away what little they have left. It's a victimization of people.
I'm also a member of the Alliance for Retired Americans, and today in our audience we also have Tony Padilla, who's the secretary of the Texas Alliance for Retired Americans. But the question here, it isn't just about the elderly or the disabled. It is about the young children. It is about the young worker who is 25, 30 and gets disabled and can't work anymore. And money has to come from somewhere. So the Social Security.
Folks, Medicare has been in existence for 40 years. It wasn't always perfect. It's been tweaked throughout the years. It works pretty well now, and it covers our most vulnerable and our seniors and disabled. I am a recipient of Medicare now. I am a recipient of Social Security as well. Medicare should be expanded to the poor and needy. Hopefully now that the Affordable Care Act is the law of the land, more families who don't fall into the parameters of Medicare will be covered. We have a young lady.
I have a story to tell because he worked for 30 years in this country, and because of his illness he had to retire, and I took care of him at home. He stayed at home.
We are celebrating 47 years of Medicare and 40 years of LACA. The cake is there. So when we all get together and sing happy birthday to Medicare and Social Security and SSI, LACA and SSI.
Are we ready?
Social Security.